Thank you so much. And I'm Sarah Wheat with Planned Parenthood Greater Texas, and I'm absolutely honored to be here with the amazing leadership that Austin has. Rosie and Central Health, all their foresight and visionary planning on behalf of our community. Representative Doggett, who, as many of you know, was a lead architect and such a key advocate for creating what we have today, which is the Affordable Care Act. And I don't know how we would have got that passed without the strong leadership by Representative Doggett. And of course, Representative Howard, thank you, always at the front of every single challenge that's come our way. Seems like every month there's something new, and we're grateful to everything you do. And I just want to take a minute to thank Amy. It is not always easy to stand up in front of folks that you've never met and tell, very personal stories about your health care. And so, Amy, thank you for being a face and a voice on behalf of so many of our patients who aren't necessarily comfortable coming out and sharing their story publicly. So I'm here on behalf of Planned Parenthood patients and Texas women who are going to benefit extraordinarily from the Affordable Care Act. Our typical patient, a little bit like you heard Amy's story, is uninsured or underinsured. She lives paycheck to paycheck, and she pays out of pocket for her health care. The majority of our patients are employed and or students, and yet those jobs don't come with health insurance. As a result, each month our patients are typically juggling what they can afford that month, whether it's an unexpected car repair, extra costs for the babysitter that month, or an unexpectedly high electric bill. Those are the kinds of costs that can come up and prevent them from coming in and getting maybe the exam that they know they're overdue and should be coming in to get. As we all are familiar, Texas has one of the highest rates of uninsured women in the U.S. And across the country, typically women pay out of pocket more for their health care than do men. Birth control to plan and space pregnancies or to treat a medical condition is the leading service that our patients come to us for. The second most common visit that they come to a Planned Parenthood Health Center for is for screening and or treatment of a sexually transmitted infection or an HIV test. The third most common is that annual exam that most of us as women are trained to know to go and get. You get that annual check and make sure you don't have breast cancer, cervical cancer, anemia, hypertension, diabetes. It's really being responsible, trying to take care of your health so that you can protect your family and your loved ones. Even when Planned Parenthood can provide these services at a reduced cost, again, many of our patients delay or forego coming in to get screenings and exams because they simply don't have the funds to afford it. When women delay routine screenings and preventive health care visits, they put their health at jeopardy, they risk an unintended pregnancy. Also, they may have a condition that, as in Amy's example, that could lead to something more life-threatening, health-threatening, and of course is going to increase the health costs for the entire system at a later date. These are all, preventive health care exams are all cost-effective investments that can prevent more expensive medical interventions later, such as if cervical cancer advances, or HPV goes untreated, or early diabetes is left undetected. We recently had another patient who wrote to us and said the following: "Thank you so much for the grant allowing me to seek treatment. I am a mother of 3. I'm married to a vet who has PTSD and a job that does not provide health insurance. I am so thankful that this program was here to help my children, my husband, and me be healthy because I was able to get the screening that I needed. Thank you." With the Affordable Care Act, the health and life-saving opportunities that are created for Texas women are game-changing. We estimate that about 1 in 5 of our patients coming to our health centers are going to be able to benefit from the exchange and going to be able to finally access affordable health care that they want and deserve. Representative Doggett mentioned some of the benefits. I mean, for women in particular, the fact that now you can access a health plan that has birth control with no additional costs. We can't add additional fees due to gender rating by the health insurance companies. And over the coming months, Planned Parenthood will be talking directly with our patients who come through our health centers. For some of our patients, they're already benefiting from the Affordable Care Act. Those that are under 26 were delighted when they learned that they could stay on their parents' plan if their parents had health insurance. And for other patients, ACA will ensure, of course, that a pre-existing condition is not going to be a barrier to health insurance that somebody wants and deserves. As many of our patients they're going to be able to purchase the health care through the marketplace. This is going to be a huge peace of mind for them. They're no longer going to have to choose between paying that credit card bill that month, kids' back to school supplies, or scheduling a health visit for an infection they may be concerned about. This coming year, approximately 220,000 women will come through the doors of a Planned Parenthood Health Center somewhere in Texas. We will be there to greet them, educate them about the enormous benefits of Affordable Care Act, and where we can help connect them to resources in the community so that they can actually log on to the marketplace, find out what insurance plans helps them and their family, and take the stress that they've had around their health care and turn that into a positive so that they know they and their family can get the care that they need. So I'm